Hey everyone, Logan Hertz here. I thought we'd do a quick update from the Mayo Clinic. So I did go to the Mayo Clinic to get some testing done. I definitely found that the Mayo Clinic is better than your average facility. For sure, the people there seem to be a little bit happier, a little bit more professional. I think they are used to dealing with more difficult cases like mine. The people that they typically get are people who have tried the standard conventional approach and haven't really gotten answers. I was pleasantly surprised by how quickly I got in. It only took me a couple of months as opposed to 6 months or never. Like Johns Hopkins, as an example, is not accepting new patients right now. So I was expecting to have to wait longer. So I was pleasantly surprised by that. I also liked how there was disagreement. I heard the doctor, when he spoke with me, he disagreed with a lot of the conventional wisdom that's out there, which I like to see that, because if the doctors disagree, that tells me someone is thinking. Whereas when everyone's all agreeing on everything, that tells me people are just following the conventional wisdom. So it's always interesting. The more you dig deeper into any subject in medicine, you find that there's disagreement. They oftentimes make it seem as if there's accepted wisdom. There might be a conventional wisdom approach, but there's always going to be some professional disagreement, which I think is a healthy thing. Which I think is a healthy thing. So that was good to see too. And I think also probably part of the reason for that is because, again, at the Mayo Clinic, they're typically dealing with more difficult cases, more mysterious cases like mine. However, the Mayo Clinic is still in the conventional medical system. So you also saw a lot of the same challenges, especially because at the end of the day, the insurance companies are still paying for most of the care. So there's a lot of those limitations that you typically see. As an example, they did not review any of my records ahead of time. So they asked for records, of course, which is a good thing. And so I'm talking with the admin who's helping do that, coordinate that to get all the records. And I'm asking, can I put in a narrative? I would like to have my own narrative so I can explain to the doctor because there's a lot of records to go through. It'd be probably best if I summarize it for the doctor and help them understand what's going on. And the response is, well, the doctor's not going to look at it. So people are traveling long distances and making a lot of accommodations to go and visit, and yet they cannot even review your case ahead of time. So when you go and see the doctor, that's the first time he's seen you, and that's the first time he's seen your records. He's not reviewing them ahead of time. And I asked them how long I should stay in town because there could be follow up tests that they order. Maybe they can be done there, maybe they cannot. I don't know. And again, there was no guidance they could give me on that either. So that was interesting. And it also seemed they had a foregone conclusion when I got there, when I spoke with the doctor. He did have a conversation with me. He did definitely spend more time with me than your typical doctor would. We had an hour allotted as opposed to 7.5 minutes. It was the doctor, who was very good doctor with a lot of qualifications and experience, and a nurse as well. So it was a good conversation. And it seemed though he still had a bit of a foregone conclusion, a bit of a box he was trying to fit me into, where most of the patients that he ends up seeing do fall into maybe a bit of a different category, but it's still a category. We ran a couple of tests while I was there, and we did discover potentially one nugget that allowed them to fit me into the box they're trying to fit me into. The challenge is, if what they're claiming is the issue, and this is just one of multiple things going on. First of all, let me back up. There's still not a lot of root cause analysis. I appreciated though that they were a little bit more honest about it. We really don't know the root cause. It can be hard to determine the root cause. Oftentimes we don't know the root cause. We just try and treat it as best we can. So at least they were honest about it, because a lot of doctors, their idea of a root cause analysis is really just begging the question. It's like you get into a car accident and someone asks, "Well, what caused the car accident?" And you say, "The car accident was caused when my car hit the other car." Okay, that's a secondary cause. Maybe that's not the root cause. Okay, why'd you have that heart attack? The heart attack was caused because your artery was blocked. that doesn't answer the question. What caused it ultimately? Doctors oftentimes don't really do a lot of root cause analysis. And I think partly that's driven by the insurance companies too, because in order to get the insurance company to cover something, you have to have a diagnosis. And so doctors oftentimes use these diagnoses not as root cause analysis, but in order to get the treatment covered that they want to give the patient. So again, it was definitely better than your standard conventional system. They were definitely a cut above, but they were also trying to fit me into a box. And so there was one potential nugget discovered from one of the tests that they ran. And one of the tests they ran was pretty much normal. The other test they ran revealed something potentially. And this other test that they ran was a test that I had actually tried to get done elsewhere, but let's just say it's a very difficult test to undergo. And with all my PTSD and mental anguish around seeing medical professionals, which is already difficult enough, I just was not able to do it. So I guess it was good that because I was there and we got it done and got it scheduled right then and there, same day, I actually got that test done. And it was an uncomfortable test for sure, but I got it done. It potentially revealed one potential nugget, which was good information, and it allowed them to fit me into the box that they're trying to fit me into. The problem is, if this nugget is correct in revealing where a problem might be, the treatment for it is a treatment that I already tried that did not work. And it's a treatment that's not easy, that requires a lot of effort and pain on the part of the patient. I'm going to try that particular treatment again. This is really just treating symptoms, although getting these symptoms under control would be helpful. And I'm going to try it with a different therapist. There's another very specialized form of physical therapy that very few people can actually do. I did get some help from them in terms of trying to find one who might be better qualified. So when I had my follow up video appointment, we went through some of that. I already have a call and email into that particular provider who's not all that close. So it's going to be challenging, but maybe they can do a better job. We'll see. I'm not optimistic, I have to say. I've learned throughout this whole multi year process to trust my intuition. My intuition is always correct in some way, regardless of what the doctors or the test results or the blood work says. My intuition has always been correct. And the doctors are trying to fit me into a set of boxes. And they don't really take a step back, listen to the patient, and try and figure out what's going on. It's always, let's run tests. That's always what it boils down to. Let's get some images, let's get some blood work, let's run whatever standard evaluation they do, as opposed to sitting back, listening to the patient and thinking about it. I do this with my clients. I did it with my clients when I was in the consulting days. Yes, we can look at data and we will, but the most important data I get is the data that comes from the client's own mouth. The most important thing I do is sit back and listen before I get into any of that, before I muddy the waters with any of that data, and really speak to the client and let the client speak and listen and just free form. And then think about it because it takes time. It has to ruminate, it has to marinate. It's not listening to the patient is not a one time thing. I think about my clients all the time. And I think all of us have had this experience where when you sit down and analyze something, there's the law of diminishing returns. When you step away from it and you're just out jogging or walking or getting a coffee, then you have an epiphany. Or you come back and look at the data with fresh eyes and you see something new. I think about my clients all the time and stuff comes up and I'm like, oh yeah, we should do that. It's not something that necessarily comes from my analysis. My best ideas don't come from analysis. I think there's something similar going on here where the doctors go through a standard set process. They don't really sit back and think about things. So, my overall analysis is that the Mayo Clinic definitely is better than your average doctor. I can see why they have the reputation that they have, but I see the same challenges as I see in the conventional system. And after visiting, I'm not super optimistic that this is going to work. And what I did ask them in the follow up, since I was trying to get them to think outside the box, look at other options, but they were just in the box completely, just saying, this is it. So I said, okay, let's fast forward. Let's say I actually do go do this therapy. I'd give it the old college try it, and it doesn't work. Then what? Then what do we do? And the answer was, well, that's it. The answer was, there's no real other evaluation we could do. And notice that word, evaluation, not thinking, not diagnosing, not let me just sit back and really think holistically about this. No, evaluation, meaning I'm going to hook you up to a machine. I'm going to run blood work. Anything to avoid the doctor actually thinking. It looks like they have found an excuse to fit me into the box they wanted to fit me into. And we're going to try a treatment that I've already tried and didn't work. Now, it will be maybe with a different provider who can hopefully do a better job, but it's already challenging. A lot of the things they're asking me to do are already very challenging. And if I had a reasonable hope that they would be successful, I would absolutely be able to put forth the effort to do them. The problem is putting forth effort in this is already extremely difficult for me mentally and physically. They're asking a lot of me, and I don't really have much hope that this is going to work. So, am I even going to be able to give it the old college try? I don't know. I guess we'll find out. But that's it. My intuition is telling me this is probably not the answer, and this treatment is probably not going to work. But it's very difficult to articulate my intuition as to what's going on. We'll see. I feel like I'm still in the same loop I've been in. And now, in fairness, some of my symptoms actually have been better since the beginning of the year, and that's been good. That's been an improvement, but there's no explanation for it. Nothing really has changed that I can link it to. I'll take that improvement. But the upshot of the Mayo Clinic is they were able to successfully put me into the box they wanted to put me into. We're going to try a treatment that I tried in the past and didn't work. Maybe if we do it with a better provider, which in fairness, I think they did identify or help to identify a better provider, maybe we'll get a better result. But it's going to be a difficult, painful process. It's not like an easy take this drug and it'll fix it. No, it's a more difficult, a very difficult form of physical therapy. So that's the upshot. I appreciate everyone's support. I wish I had more optimistic things to say, but I'm just trying to be realistic. And this is realistically, this has been going on for years. I don't know if it's ever going to change or find a quick, easy fix or find a breakthrough would be nice. But I think the more this drags on, the less likely that is. But thank you guys for watching. Greatly appreciate it. Bye bye.